Each of us has lived moments that, but for the grace of good fortune, could have been catastrophic for ourselves or a loved one. Dr. Edward Nishoff became paraplegic after a diving accident. He was 20.
I think becoming disabled is in many ways similar to having someone very close to you die. There's a profound sense of grief at the time of the loss. It takes time and perseverance for that hurt to go away, and if someone is able to persevere, I think the time will come again when they're able to feel good about themselves and the life that they lead.
On the eve of Mother's Day, Doug McLain was thrown from his motorcycle and fractured his spinal cord. He was taken to Receiving Hospital, where doctors operated.
I don't remember anything about the accident. I vaguely remember getting picked up in the ambulance. No, that's about it. I can't remember much about it. But I do remember realizing that I couldn't move at all, and I couldn't feel anything.
One of the most important tasks I have is to try and dispel these misconceptions they have that their misery will be unending. I think that is the fundamental cause of heartbreak for many people, and my position is that this is a transition, a profound loss from which someone can recover and redefine themselves.
Sharper dull?
After a week at Receiving, Doug was moved to RehaMORE, the Rehabilitation Institute of Michigan. Doug's spinal fracture was incomplete, so he retained some feeling in his legs.
I don't even entertain the thought that he's never going to walk again. He's got the will, he's got the desire, and he works hard. He wants to work hard. The doctors originally said 10 to 20% chance of recovery, and I kind of figure the way I look at it is somebody's got to make up those 10 to 20s, and I think he's going to be one of them.
What do you want to work on while you're here?
To walk.
To walk?
I'm walking out here.
All right, at this point, I can't really tell you if you're going to be able to walk, but I'm going to show you a lot of things you can do on a wheelchair level.
This is Doug's first day of therapy at RehaMORE. RehaMORE is regarded as one of the nation's leading hospitals for rehabilitative medicine, both for research and patient care.
All right, very good.
Gabrielle Stowes is a senior therapist.
Not so bad.
Not so bad? I try to establish trust with my patients from day one when I meet them. Push over, okay? And educate him that it's gonna get better, okay? That was very good. We do motivate our patients a lot, and it's more like the belief in themselves. We kind of like strengthen that a lot here too, beside muscles and everything. I also show people that they get a second chance, because everybody who had a spinal cord injury could have died too, because it's such a severe injury.
3 evenings a week, a group of former RehaMORE patients work out together at the hospital. Almost all are paraplegic because of gun violence. Mario Dixon was shot 13 years ago.
My thing is I want to be independent as possible, and that's one thing this hospital has taught me, and I know every other patient that's come through here is try to be as independent as you can. Do everything that you can for yourself.
The therapists at RehaMORE challenge their patients to be self-reliant.
And once you get them up, turn those back down.
At the same time, family members are encouraged to become part of the recovery process.
You okay?
I think I need everybody right now. This is too much. This is too much to take on by myself. This is a big one.
After a week of therapy, Doug came down with an infection and for the first time felt disheartened.
I haven't lost any faith about recovery yet, but I get frustrated. I have a couple times already, especially when it comes to having a lot of pain, that really, really gets on you.